Officials with the Centers for Disease Control and Prevention testified before lawmakers today. CDC officials say the current Ebola crisis in West Africa is on pace to sicken more people than all other previous outbreaks. Arise News' Kelsey Minor has been following this and is here in the studio with more. Kelsey.
Well, Wendy, U.S. health officials are calling the outbreak unprecedented, in part because West Africa has never dealt with Ebola before. Across the world, people are on high alert. So much so, it's prompted the CDC to issue a level 1 alert on the medical issue. It's being called the world's worst Ebola outbreak in history, and on Capitol Hill, lawmakers are getting a first-hand account on its impact.
That we have to stop it at the source through tried and true means, the core public health interventions that work.
Centers for Disease Control and Prevention Director Dr. Thomas Frieden has ramped up the response to the disease. 200 more staff members are in Atlanta working on the outbreak. An additional 50 disease experts will soon be on the ground in West Africa to try and contain the disease.
We can stop Ebola. We know how to do it. It will be a long and hard fight, and the situation in Lagos, Nigeria is particularly concerning. But we can stop Ebola.
The outbreak has been widespread across West Africa. Guinea, Sierra Leone, Nigeria, and Liberia are feeling it the worst. So far, 932 people have been confirmed of dying from the virus. Panic has taken hold of the region, and West Africans are left wondering how to live.
Of course, I am concerned about my health. I don't even know how to relate to people anymore. I don't even know how to shake people anymore. I'm scared of talking to people. I'm even scared of coming close to my own very close friends. You know, this is what Ebola has actually caused to some of us.
Meanwhile, concern in the United States remains high. In New York, it's been determined a man isolated after reporting symptoms tested negative for the virus. 2 U.S. aid workers are said to be responding well to treatment in an Atlanta hospital. All of this pushing the Obama administration to set up a working group that would consider policy on using experimental drugs to help fight off spreading of the disease. One major question is the likelihood of the virus spreading across the United States. CDC officials don't rule it out, saying it's possible. Because of that, hospitals are now required to ask patients for travel history when they are experiencing Ebola-like symptoms. Wendy?
Kelsey Minor.